Now, depending on whether you're an adult or a child, we're going to approach how to fix or even prevent sleep apnea a little differently. So I'm going to start by talking about a child. The first way to prevent having sleep apnea in a baby is to make sure that that baby is breastfeeding as long as possible. What our studies are showing is the longer period of time that a baby is breastfeeding, the less crooked teeth that they will have. And the reason for that is breastfeeding will encourage that baby's tongue to be up against the roof of their mouth. And that baby will actually have to work to get that breast milk out. As opposed to drinking out of a sippy cup, that sippy cup will actually push that tongue down and do the opposite that we want. When that tongue is up against the roof of the mouth, that's going to help that jaw expand and give more room for that baby's teeth to come in the right place. And in turn, also make room for that baby to be able to breathe normally and prevent having sleep apnea. And the second thing is to stop feeding your kids mushy foods. We know from history and we know from studies that babies are able to feed themselves solid foods. So I'd recommend starting at the age of 6 months to make sure that that baby is eating solid foods. I would avoid all the store brand Gerbers and mushy foods that are out there right now because those are actually doing the opposite of what we want. Obviously, it would be a good idea to have a parent or a guardian supervising that baby as they're eating. But things like celery, apples, pears, or carrots, all of these things are going to be much better than those mushy foods that we have right now that are not doing anything for their jaw development. Instead, when we actually get those babies to start chewing foods earlier on, this is going to be really crucial for their jaw development growing forward. Now, the other thing that you want to enforce is chewing with good oral posture. Now, this is something that a lot of adults can benefit from as well. It's basically just going to be making sure you're chewing with your mouth closed. And what you'll find is that can actually be sometimes harder than you think. Sometimes when you're chewing on a tough piece of meat or something, you want to keep your mouth open as you're chewing it, but you want to make sure you keep your lips closed because this will also help engage your jaw muscles and also help engage those stem cells, especially in that jaw that's developing to start growing. And also you want to make sure you have good oral posture in general. And again, this is something that adults can practice as well. So the perfect mouth posture will be your lips closed with your teeth slightly touching and your tongue against the roof of your mouth. This is how you want to train yourself to be at all times of rest. So for a kid, this is going to be a lot easier because if you train a child to start being like this at all times, they're going to be way more likely to develop these habits later on in life. As opposed to if you're a 30-year-old or a 40-year-old watching this, it's going to be a lot harder to start transitioning to this posture. It's still possible, but it's going to be harder. A lot of people like to call this perfect oral posture different names. One really popular one is called mewing. And one reason it actually got that name is because a guy named Dr. Mew actually developed something called orthotropics, where part of it actually involves having proper oral or proper mouth posture. Now, it's also a good idea to have good posture in general. So not just your mouth posture, now the rest of your body as well. Because what we've also seen is people who have a head forward posture or where their head is tilted forward all the time, that's also associated with people that have crooked teeth. Now, part of the reason for that could be that your tongue is actually connected to your neck muscles. And if your tongue is always against the floor of your mouth or the bottom of your mouth and your jaw is always hanging open, that's going to pull your head forward. And another reason for that is because right now when your head is up straight, your head weighs about 12 pounds. For every inch that your head falls forward, that adds a whole 10 pounds. So if your head is forward 3 inches, that's going to add 42 pounds of strain on your neck and shoulders compared to just having a normal 12-pound head. So having a proper mouth posture where your lips are closed and your tongue is against the roof of your mouth is going to help keep your head back because your jaw is not going to be pulling your head forward. Now, another thing you can try as a child is growing a little older, and even an adult can try this, is chewing gum. Now, a lot of times in different cultures, chewing gum is frowned upon or seen as a bad thing, but chewing gum is a great way to actually engage your jaw muscles. Now, when you're chewing your gum, you want to make sure you focus on a couple things. The first one is you want to chew about 30 minutes a day. I know that seems like a long time, but you'll notice that whenever you're chewing gum, you can go a lot longer than 30 minutes without realizing it. You also want to make sure that you're chewing evenly on both sides. You don't want to just develop one side of your jaw muscles and neglect the other side. And we have studies actually showing that chewing gum can actually improve your cognitive performance. Now, obviously, when you're looking for chewing gum, you want to find one that's completely sugar-free. My favorite ingredient is xylitol, because studies have actually shown that xylitol can actually help prevent you from getting new cavities. And again, whenever you're chewing this gum or having a child chew this gum, you want to make sure that they have that correct oral posture, so make sure they don't chew with their mouth open. Now, the last tip I have to prevent sleep apnea in a child or even an adult is to make sure that you're focusing on nose breathing at all times. That is only using your nose to breathe instead of your mouth. If you look back at our ancestors, at all times, they would be using their nose to breathe, even when they were hunting or running for extended periods of times. Now, I want you to imagine going outside and running 1 mile without opening your mouth at all. Seems pretty difficult, right? But breathing through our nose gives so many benefits that our mouth simply does not give. One of the biggest things is our nose actually filters out a lot of the air and the dust and particles, and also 99% of viruses and bacteria. So that means that people who regularly breathe through their nose are going to be way less likely to get sick than someone who is a mouth breather. A lot of times I hear people complaining that they have allergies or they have a really stuffy nose and they cannot breathe through their nose in the first place. Well, I want you to think about this for a second. What is the reason that you cannot breathe through your nose in the first place? Most likely it is because you were originally a mouth breather in the first place, and that actually contributed to that stuffy nose. So training yourself to start breathing through your nose is going to really help you in the long run and prevent those stuffy noses and also prevent a lot of those allergies. So one simple trick you can do to start breathing through your nose better is called a nose unblocking exercise. I actually made more videos on this, and I'm going to put a link in the description below where I go more into detail on it, but I'm going to give you a little demonstration how to do it right now. Basically, it involves taking a normal inhale and exhale out through your nose. So you can hold your mouth and go, and after that exhale, you want to hold your nose and hold your mouth and start bobbing your head back and forth as long as you can until you have a medium to strong urge to breathe. So it's going to look kind of like this. Basically what that's doing is it's increasing the circulation in your nose, and it's also building up CO2, or a molecule called carbon dioxide. And what that ends up doing is it starts opening up and dilating those nasal passages. Because first of all, CO2 is also a vasodilator. So it's going to start dilating all those blood vessels. And the second thing is, once your body senses that there's more CO2 building up, it's going to put a signal to your nose to stop producing as much mucus. So I want you to do this for 6 sets. So after you do 1 round of this, you're going to want to recover by just breathing through your nose for about 1 minute. So after I'm done bobbing my head, I'm just going to relax by breathing through my nose for 1 minute. And you don't want to be breathing super hard. Just breathe normally for that 1 minute, and then repeat that exercise a total of 6 times. Now you can also do this exercise by, instead of bobbing your head, you can start walking. So if you're walking on a track, just walk as many paces as you can, again, until you have that medium to strong urge to breathe, and then you recover by breathing through your nose. You can do this either if you're a child or an adult. Either way, this is really going to help you improve your breathing. Now, some other things you can try are, if you have allergies, taking an allergy pill before you do this exercise, and also cleaning out your nose before you start this as well. So you can put like a saline rinse in your nose. One really popular one is called the NeilMed Sinus Rinse, and that'll end up going in each nostril just to help clean out that nose before you start doing this exercise. And you can also try using a nasal decongestant spray, which is a spray that goes in each nostril and helps open up your nose a little bit so you can do this exercise properly. Once you're doing this exercise, you want to make sure you do not open your mouth up in the middle of it or afterwards, because if you start using your mouth again, it can quickly clog up that nose again. You can do this exercise as many times as you want throughout the day, and what you'll find is the more you do this, eventually you might not have to do it as much as you start getting better and better at breathing through your nose. I think one of the best times to do this is right before you go to sleep, because after you're done, you can try my last tip on how to help breathing through your nose, which is a mouth tape. That's simply putting a medical grade tape over your nose right before you go to sleep. And that's going to help encourage you to keep breathing through your nose all night long. My favorite tape to use is called a 3M micropore paper tape. It's really cheap and it's really easy to use. You just rip off a piece and tape it over your mouth, and then it'll help encourage you to breathe through your nose all night long. Now, if you're an adult and you're watching this, just know it's going to be a lot harder to fix your jaw structure and a lot harder to make your jaw wider without getting any sort of device or surgery. But there are still a ton of benefits you can get from improving your posture and improving your breathing specifically through your nose. We have a lot of studies on using a mouth tape and a nasal strip, which is basically a strip that goes over your nose and helps dilate your nasal passages a little bit. You can also use a nasal dilator that is basically something that goes inside of your nose that helps dilate your nasal passages a little bit. We also have a lot of studies on the nasal decongestant spray I was talking about. And all of these things, even if you don't improve your jaw structure at all, it can still help prevent sleep apnea, even fix sleep apnea in some cases, or at least make the sleep apnea less severe. Now, just because we have proven ways to actually prevent sleep apnea or actually fix it in some cases, there's still sometimes that you have to see a specialist and get some sort of surgery or some sort of device made. Now, the ideal way of doing this would be to get a baseline sleep study. So before you do anything, get a sleep study, and then you can try doing the methods that I talked about, like the mouth tape, the nasal dilator, and all the other nose unblocking exercises and the posture techniques, and then get another sleep study a couple weeks after doing those things that I talked about and see if there's any changes in your sleep performance. If you notice that you still have very severe sleep apnea after all these changes, then I would say it's time to go to the next step and get a device made. So try to get a CPAP machine. That's probably the first line of defense. There's also some specific dental devices you can get made that actually advance your jaw forward and can actually open up your airway without putting that CPAP machine on. You can probably look into that by going to any dentist, and they may either refer you or actually treat you themselves. The absolute last resort when nothing else is working is to get a surgery done where you actually advance your jaw forward. That can be really hard to recover from. It can be a little painful, but if everything else fails, that is also an option. But the other thing with that surgery is there's a lot of surgeons that are going away from doing that as well, because a lot of them don't want to take on the risks and they just don't get as much reward from it than seeing a normal typical patient. But there are still some surgeons that are doing it. Now, the last thing I wanted to talk about is signs that a child will have sleep apnea in the first place. Now, if you didn't watch the full video, I'd recommend watching that. I'm putting a link in the description below where you can see that. And I also talk about how you can actually fix sleep apnea or even prevent sleep apnea in a child in that video as well.
One of the biggest reasons people need to consume caffeine is because they're not giving themselves enough sleep opportunity time. Now, that is time actively spent trying to sleep in bed. So let's say someone is sleeping 8 hours a night. Now, when someone says they sleep 8 hours, what does that actually mean?